Welcome everyone to today's conversation. My name is Christina Becker and I'm the Knowledge Mobilization Manager here at APHSA, and we're really pleased to be hosting today's presentation with NARS. I'm going to take a moment at the top to provide a brief overview of APHSA, and then I'll hand it over to our presenters for the main presentation. And as Trevor said, we'll facilitate the Q&A at the end, so please do make sure to submit your questions as we go along. So if you're not familiar with us, the American Public Human Services Association is a bipartisan nonprofit membership organization, and we represent state and local health and human service agencies throughout the country. We also house several disciplines in health and human services, whose members are the administrators that operate agency departments in states and localities. So that could include our membership of SNAP directors, TANF administrators, child welfare administrators, and many others. You can find additional information on our website, such as our latest policy analysis, links to our social media, and you can sign up for our weekly health and human service policy analysis emails there as well. So with that overview, I'm going to hand it to Lauren to provide you with a brief overview of NARS.
Thank you, Christina. This is Lauren Untel, the Associate Director for Strategic Initiatives from the Administration for Children and Families Office of Regional Operations. And I'm really pleased to welcome you to the 7th webinar of the 2020 NARS virtual series. NARS, the National Association for Welfare Research and Statistics, holds in-person conferences every other year where human services researchers, practitioners, and policymakers come together to talk about their work and how it can inform policy and practice. Several years ago, NARS began holding virtual events in the off years when the conference wasn't occurring. These events represent an opportunity to keep the community engaged and highlight interesting research and trends relevant to our membership. Before we get started, I just wanted to plug, we'll have one more event through this series on cross-system collaboration for serving justice-involved clients. And we'll soon be announcing the date, so keep an eye out on our NARS Twitter feed at NARS Workshop and on our website, nars.org, for more information. We're also recording this webinar, and we'll post it to the website in the days to come. And there you can find all of the recordings from the previous sessions in this series. If you're interested in learning more about the organization or volunteering with us, please sign up for our mailing list at the link provided. To close, I just want to extend a great appreciation to all the folks who made this panel possible. A huge thanks to our sponsor, APHSA, and particularly Ann Flagg, a NARS committee member, and Christina Becker, as well as Asaf Glosser, my co-chair on the virtual events committee, Kate Steepleton, and Jordan Engel of MEF Associates. All of these individuals were really instrumental in making this come together. And finally, I want to thank our panelists. They've been giving their time leading up to this event, and I'm really looking forward to the important conversation we'll be having. So now I'll turn it over to Kate Steepleton of MEF Associates. Thanks.
Thanks, Lauren. Well, good afternoon or morning, everyone, depending on where you are. I'm Kate Steepleton. As Lauren said, I'm with MEF Associates, and it really is my great pleasure to welcome you to today's webinar. So in the months since COVID-19 arrived in the U.S., families and the systems that support them have been struggling to adapt to rapidly changing circumstances and unprecedented uncertainty. Many have expressed particular concern about how the compounded stresses of the pandemic might be contributing to child abuse and neglect, which, because of school closures and stay-at-home orders, could go undetected, leaving children unprotected and families without help. Indeed, headlines and publications across the country have noted marked decreases in calls to maltreatment hotlines, followed by questions about whether these drops in reporting are masking other trends. There are questions about whether maltreatment dynamics have changed since the pandemic and ensuing recession began, and there are questions about how the child welfare system shifts to carry out its mission when quarantines and social distancing are the order of the day. Underlying these, though, there are additional questions. With staggering numbers of families experiencing what we know to be risk factors for maltreatment, tenuous economic situations, social isolation, and unstable housing, to name a few, there are questions about what the role of the child welfare system has been and what it is, not only in addressing child maltreatment, but in preventing it. There are no easy answers to these questions, but our aim today is to begin to unpack them. We have 4 excellent panelists with us today to share their research, experience, and reflections in our discussion. We'll begin with Carrie Raytheon, Associate Professor of Public Policy at the University of Connecticut. Then we'll hear from Kelly Fong, Assistant Professor in the School of Sociology and History at Georgia Tech. Drs. Raytheon and Fong will be sharing new qualitative and quantitative research with us. Next, Danielle Martin from Michigan's Department of Health and Human Services will describe how that state's child welfare system moved quickly to understand family needs early on in the pandemic. And finally, we'll hear from Angela Green, Region 5 Administrator with the Administration for Children and Families. Each panelist is going to speak briefly, and then I'll pose a question or two for discussion, and we hope to have some time at the end to address audience questions, so please do place those in the chat as you have them. And without further ado, I'll hand it over to Dr. Raytheon.
Thanks, Kate. It's great to be here today. I appreciate this opportunity to speak and to learn. So Kate asked me to talk about what we knew about measuring COVID's effect on child maltreatment from a quantitative perspective. And I've been really fortunate to be working on a very much interdisciplinary team that's trying to understand this. And the work that I'll present today is very much joint work with Lindsay Bellinger, Angela Boy, Megan Feely, Stephen Messner, William Schneider, and Shannon Self-Brown. And I want to give particular credit to Lindsay Bellinger, who's been the one running the quantitative analyses. So I just want to give her a lot of credit. So one thing I will say before I start is to keep in mind that everything that we have to say is very much preliminary, right? There's a lot about COVID and measurement that we just don't know. But I'm going to share some of our early work from two states in particular, Indiana and Georgia. What I will sort of preview is they show different stories, and I think that that's going to be important in understanding how COVID is affecting kids across the United States, as there probably isn't one answer, and we need to keep that in mind as we craft policy response and program intervention. Okay, so I think this is probably not news to a lot of people in this audience, but I wanted to ground my remarks in first thinking about who reports child maltreatment to Child Protective Services. So I used the child maltreatment DHHS report from 2020, which uses the NCANS Child File 2018 data. So one thing to keep in mind is we typically have our national data set, which is the NCANS Child File, and about a 2-year lag. So we probably won't get national child maltreatment data until about 2022. So this is the most recent sort of who's reporting child maltreatment. The red pie is education providers, so that's school and daycare. The yellow are social service professionals, which includes law enforcement. The green is medical, which provides both mental health medical and physical medical treatment. The purple I've called non-government, that's friends, family, neighbors, etc. And the blue are other and unknown, which includes missing, we don't know who reported it all, and anonymous, or just they're marked other in the data file. So the important thing to take away here is about 60% of reports nationally come from mandated reporters, right? And what COVID did for a lot of families was put them in their homes and really decreased interaction between families and mandated reporters, and so, or at least the traditional avenues of contact. And so it's not surprising that we've seen, as Kate previewed in her remarks, a decline in reports because families aren't around mandated reporters as much. And in particular, we calculated this for our Georgia data. So this line graph is only from Georgia. This is not national. This is Georgia data. And the line, the vertical line is sort of when COVID closures happened in Georgia. And what you see is education referrals were the primary source of referrals at this time in Georgia. That dip is when Georgia took spring break. So you see after the vertical line a really pronounced drop in referrals, with educators going from the most common reporter to the least common reporter. And you see other categories declining as well, though not as dramatically. So reports in Georgia went down by a lot, driven by a decline in education reports. Oh, I keep doing that. There we go. But the question, of course, also previewed by Kate's remark, does this drop-in report measure a real reduction in child maltreatment, right? We often use these child maltreatment reports as a proxy for our understanding of the prevalence of child maltreatment in our community or the incidence of child maltreatment in our community. And, you know, I think the answer is this is unlikely. Like, I don't think that child maltreatment actually declined by 55%, even though, you know, referrals in Georgia declined 55%. And we're seeing similar trends, at least anecdotally, nationally, though we don't necessarily have the, these researchers don't have access to that data to confirm that, but I think that's probably true in most states. Sorry. Right, I think the reality is that COVID-19 has brought a host of stressors to families and communities that makes kids more at risk of child maltreatment. Many families have seen a reduction in economic resources, and where federal stimulus and unemployment benefits probably help families in the immediate COVID closure time, we are seeing that federal assistance and in some states, state level assistance is coming to a close, meaning the economic pressure in families is heightened. And we also know that families do worse under times of economic strain, right? There's a reduction in available time for parents to actually spend with their kids. And to me, this reduction in time and money is really important. I often say that the things that make me a better parent are time and money. And I think that is true like across the board for parents. I think that all parents need time and money to spend with their kids, and COVID has really put pressure on both of those. And then, of course, we also see a reduction in other available supports like school closures, childcare, which provide parents with quality childcare for their kids, as well as a partner in childcare. But also we're seeing strains on things like houses of worship that also just provide community support for families. So strains from all aspects, and I think that in general that's going to put kids at risk of child maltreatment. So I'm going to start by just giving you a high-level preview of what we found using data from Indiana. So Indiana, the Department of Child Services, puts pretty much real-time aggregate report data on their website. So they report at the county level, the month and county level, their child maltreatment reports as well as their substantiations. And they also do this by type: neglect, physical abuse, sexual abuse, and physical abuse. And so we look at that. And we are able to obtain cell phone data, proprietary cell phone data, where we can look at how much more on average families in a given county are staying at home. And what we find is that in a time of COVID, I should back up. One of the things we do is we break families into families that stay home the least, that's quartile 1, and families that stay home the most, that's quartile 4. And what we find is that families that stay home the most, that experience the largest change in their average hours staying at home, see the highest increase in neglect substantiated child maltreatment reports. And almost all of our finding is driven by the 4th quartile and by neglect substantiated reports. Sorry, my animations. This is just summarizing what we find. Areas that stayed at home more had a change in staying at home, which is quartile 4, had increased levels of child maltreatment, specifically neglect, and those are substantiated reports. What's interesting to us about this finding is those counties that comprise quartile 4 are areas that had traditionally lower levels of child maltreatment to begin with. In Indiana, they tended to be the more affluent counties. They tended to have higher educational attainment on average. They tended to have other fewer risk factors in general. And so that is going to be contrasted by what I tell you next, which is our data that comes from Georgia. So Georgia, their Department of their CPS version puts actually weekly child maltreatment data online and further breaks down neglect into supervisory and educational neglect as well as material neglect, so we're able to sort of drive a little bit more into neglect. But we use a similar estimation strategy wherein we look at the same cell phone data and we try to see, we ask, how do child maltreatment reports at the county level in Georgia, but at the weekly time frame change based on the average amount of time families in a given county are staying at home. And what we find is that counties where people stayed home longer, on average, experience higher child maltreatment rates. In particular, we find more supervisory neglect. And this is driven by metropolitan counties in Georgia. And this is counties that have historically lower report rates. We also find more educational neglect. And this is particularly in higher poverty counties and in particular counties that have historically higher report rates. So depending on the kind of neglect and the kind of child maltreatment, we find that different counties are at risk of this kind of neglect. I should also just clarify, these are referrals, not substantiations, so we find the same thing. We just look at substantiations, but these results are in particular referrals. So this is a bit of a quandary for us that more time at home leads to more supervisory neglect in particular because you're at home. However, I don't know about all of you, but when I have been working at home and also in charge of my children, there have been times when that seems worrisome. And so I think that lots of families are struggling with how to both work from home and be at home and have their children at home in a safe and consistent way. One thing I think that is noteworthy is to think about where this child maltreatment data jives with other data and other findings that we're seeing, because there's definitely measurement error in what we're seeing with these child maltreatment reports, right, given that we're not seeing lots of interaction between kids and mandated reporters. So Shaya Shetty also looks at ER visits and finds that we're seeing an increase of high acuity pediatric visits, so pediatric visits with fairly serious physical injury. And in particular, what's interesting about that paper is they see a shift where kids with private insurance are disproportionately more likely to come into the ER as opposed to previous visits. We also see an increase of daily calls to poison centers, indicating that kids are having access to different poisons or could just be bleach, household cleaners, etc., things that are in the household. And we're seeing more home-based fractures as well, which can come from jumping on trampolines to bicycles, right, things that kids are doing while their parents are working. And I think that helps to sort of put the supervisory neglect finding into context. So that's what I wanted to say in my remarks. And I'm going to pass it over to Kelly.
Great. Thank you so much, Carrie. It's wonderful to be with all of you today. I'm going to pick up on where Carrie left off to give some qualitative context for some of these overall trends in child maltreatment reporting. So in thinking about the implications of this sharp decline in CPS reports that both Kate and Carrie noted, I think it's important to ask what we're missing, right? What's not been happening in the past several months. So in the before times, as I like to say, CPS had a pretty wide reach, right? So they got a lot of reports, around 2.5 million each year. But most of these contacts actually don't go much further than the investigation. So in the vast majority of cases, no allegations of maltreatment are confirmed. And this is especially the case for reports from educational professionals, which is where we're seeing the sharpest decline during the pandemic. So most of these cases close at intake, and almost all kids remain at home in the months following the report. So to understand more about these cases that get deflected from investigation, I conducted a research study in partnership with 2 area offices of the Connecticut Department of Children and Families before the pandemic. So I shadowed social workers as they investigated cases. I also did about 100 interviews with participants in these cases, including mandated reporters, investigating social workers, and investigated mothers. And based on this research, I want to suggest that our collective challenge is not how to make sure reporting gets back to normal, whatever that means, but that we can and must do better than the status quo. So as I'm sure most of you all know in this audience, these huge drops in reports don't mean that millions of kids have serious injuries that are going unaddressed, right? Instead, I found in my research that CPS has really become this collection point for the wide-ranging concerns that professionals have about families. And this is not to minimize or dismiss the serious and challenging situations that many kids are in. So reports typically do involve families facing adversity from poverty to homelessness, substance misuse, domestic violence, mental health concerns, and so on. But reporters that I spoke with didn't think that kids necessarily needed to be removed. So in one case of the study, a school-based clinician reported a child's possible exposure to sexual behavior in the home in the context of a number of other concerns that she had about the family. And she said, CPS can put in place family therapy. You know, the parents, it sounds like they're both extremely stressed. They have a lot of socioeconomic issues, basic need issues. And she says, I don't think that this is a kid that's in imminent danger necessarily. I just think they need some more education. I think they could use some parenting skills, knowing what's appropriate, what's not appropriate. So in her role at the school, these were things that she couldn't take on. And so she was calling on CPS not so much to rescue kids that were in grave danger, but instead to intervene in ways that she felt she couldn't. And these processes are highly racialized, right? So it's often families of color that we believe need, you know, quote unquote help or rehabilitation from an agency like CPS. So all of these cases come to CPS, but investigators that I spoke with often felt that they didn't need a child protection specific response, meaning one that only CPS could deliver. And CPS isn't organized around meeting families' persistent material needs. So in another case, for example, a hospital social worker reported a mother's housing conditions, and the investigator knew that the reporter was just calling seeking support for the family, right? But she felt frustrated because CPS couldn't offer ongoing rental assistance. She said, you know, I think the entire community thinks CPS can save them all, provide housing, fix their financial problems. I think that's the misconception of people in the community. I'm not sure why, but I feel as if they cannot service the family. They feel like we will be the backup plan. So she did her 3 visits, her collateral contacts, her interviews, all of her paperwork, but ultimately she deemed the home environment safe and closed the case. And so these are the kinds of cases that take up a lot of investigators' time. And funneling these concerns to an agency empowered to remove kids also has important consequences for family well-being. So reporters and investigators were often confident from the start that kids wouldn't be removed. You know, but parents understandably feared the worst. So these are the kinds of things that I heard time and time again, kind of reflecting this really acute anxiety upon CPS's arrival. And even in the best case scenario where cases were closed promptly and parents ultimately came to view investigators positively, reports can really strain relationships with reporters who are the very people and systems we're tasking with supporting families. So in one case, a mom said that after she was reported for testing positive for marijuana during her pregnancy, she felt that she couldn't trust the prenatal clinic anymore, and she hesitated to speak openly with the midwife there. She said, it was certain stuff that I didn't want to say to her because I didn't know if she's going to go and tell. Like I thought when I first had him that I was going through postpartum depression. I don't tell them how I feel. I don't tell them any of that because I don't need them to say, oh, she's going through postpartum, she's going to hurt the baby. So these reports can really undermine trust and engagement and help seeking with these crucial systems of support. So absolutely many kids are in difficult situations, and these challenges, as Carrie noted, are only exacerbated by the pandemic. And I think the question is how we should respond. So, you know, we've delegated so much to CPS, and I want to challenge us today to think about why we route so many low-level cases through CPS in the first place. So one idea is that these are early warnings, right? Opportunities to prevent more severe maltreatment. And I would encourage us to think about prevention beyond CPS. And this is something that I know that agencies in Connecticut and elsewhere are really committed to, are really thinking about, right? Because they know that they cannot do it alone. One thing I recently heard in Connecticut was, you know, they want the hotline, the CPS hotline, to be the last call that people make and not the first call. And so in thinking about this prevention beyond CPS, to the extent that CPS does offer referrals to social services, which they often do during the investigation, does it need to be CPS that's doing this, right? Or are there alternatives that we can build out that don't foster this sort of fear and undermine engagement? And I think also we can certainly think of therapeutic service referrals as prevention, but primary prevention also encompasses things like housing, employment, childcare, transportation, all of these things that families need, but that child welfare agencies by and large aren't able to provide. So I've been thinking a lot about something that Arundhati Roy wrote several months ago at the start of the pandemic. She wrote, "Historically, pandemics have forced humans to break with the past and imagine their world anew. This one is no different. It is a portal, a gateway between one world and the next." And she asks in this piece, how will we walk through the portal, right? What do we want to take with us? And so as we're seeing CPS called upon less during this pandemic, I think this really may be an opportunity to build out and invest in these other means of supporting kids and families. So I will leave it at that and turn it over to Danielle.
Wonderful. Thank you so much. And I appreciate Dr. Razian and Dr. Fong for laying the framework for the steps that Michigan engaged in to respond to the pandemic. We really, as was noted earlier, experienced a reduction in our centralized intake calls by about 50% as well. And so, as Dr. Fong said, we wanted a proactive approach that would help us re-envision child welfare, frankly. And we have the privilege of having Director Chang at our leadership, who's a real visionary in child welfare. And so she asked us to all step back, as Dr. Fong said, and really think anew. This is a fantastic opportunity to, at the height of FFPSA implementation, re-envision child welfare. And so rather than panicking, I guess, about this situation, we looked internally at opportunities that we had to begin our transformation as we enter a more preventative type of child welfare system. We knew that the research completed by Chapin Hall for us revealed that families who had experienced recent child welfare involvement, particularly our category 3 and 4 cases, which are generally are low to moderate risk. Those are families who don't receive services. As Dr. Fong indicated, those are about 75% of our cases for our category 4s where they're denied and they don't receive intensive services or interventions, particularly by the department, that those were the most vulnerable families. We also knew that populations of color, particularly in our southeast side of our state, were very vulnerable. They were experiencing COVID at higher rates. Their access to supports and services were more limited. And so that's where you see on my slide the 14,162. So we use that data to extrapolate recent case information for families who, again, had experienced recent investigations that led to either a denial or very short-term interventions and services by a CPS ongoing worker. And we asked that our staff reach out to those families with a script and very fluid script with a helping focus. Not so much that they were, as we've already heard, approaching families from that contextual framework of we're here to help, but we have the ability, unfortunately, to create situations that can be unsettling to families. So we coached our staff through that. We trained about 500 staff in a period of 1 day and asked that they complete outreach, which we started on April 24th. And so as you'll see, of those just over 14,000 families, we reached about 8,200 families by email or phone, direct contact, sending packets. And then our additional actions as a result of that, you'll see bulleted, really just contemplating how we could use this method ongoing to outreach to families in a preventative strategy rather than waiting for that crisis to occur or waiting for a call to be made to our centralized intake. It also afforded us the opportunity to see, as we've already heard, that that there are particular gaps, particularly in the areas of domestic violence and housing and resources, that we wanted to better understand, not only as we unfold our efforts as it relates to FFCSA, but just in general how we could support families better. We also collaborated with our Economic Stability Administration, which afforded us an opportunity to understand what benefits programs were more problematic for families to access, such as child care or cash assistance. We determined as a result of our efforts that there were resources that families asked for, and then there were resources that we provided. So the first slide that you're seeing is that services that families indicated. And we know sometimes, again, being the recipient of a contact from Child Protective Services can be unnerving, as we heard earlier. And so this slide might not be indicative, certainly, of all of those things because of the vulnerability of asking for help, frankly. But what we do know is families said general support, financial assistance, food and nutrition were some of the primary areas that they recognize it would be helpful to have additional information and support. But what was interesting, we also learned that families were provided resources from workers who generally these workers completing outreach were our protective services investigators. So they're astute at resources and services in the community, but also teasing out those needs that families might have if they're not inclined to readily share that. So we did learn, as this slide indicates, that, again, financial assistance, food and nutrition, housing are all areas that families were offered information and services by the workers. So we knew that there were a great number of families who were receiving support and information. We also compiled a resource packet of all resources and services throughout the state, including crisis lines and helplines that families might not be cognizant of. We furthered this by stepping back subsequent to the initiation of our phase, what we call phase one. So phase one, as I said, started on April 24th. And then we decided that there was such success in this outreach effort that we wanted to continue orienting families to this opportunity of CPS looking a little bit different than they had been acclimated to before. So we asked the field again to complete this outreach. And on August 10th, they began outreaching to families. And as you can see, our numbers are slightly lower, but surprisingly to us, these, the 10,834 cases were very much the same, drawn directly from our MySACWA system, which revealed cases that had been closed or denied during the 3 months prior to August 10th. And of those, we had a slightly lower response rate from the 80-ish% prior to 49%, but also noting that we were out in the field more so at this time and resuming regular practice and face-to-face contact, so that might contribute to that. What's interesting, though, and we see on this slide, is that the resources offered and the resources requested are very different. Not surprising to us that domestic violence is the primary area that we provided resources, because we were hearing from the field that the cases that they were responding to were displaying with increasing concerns, particularly in the area of domestic violence and just family instability. Certainly housing is our secondary area that we can see. But this gives us critical information not only regarding the vulnerability of families, but also as we move forward toward a more preventative approach in Michigan, where we need to focus our efforts. So helpful in that regard as well, and frankly essential for those families who have an opportunity to talk to someone who can provide potential resources and support. And in this slide, we basically just, again, see or offering resources or the families identifying resources. These are specific resources requested by families. And obviously, not surprising, housing is the #1 resource that was requested by families. But interestingly enough, families were at a point as of this August implementation to maybe be more receptive and vulnerable and honest about just needing mental health and other medical substance abuse services. So I think, again, it's twofold. Exercising opportunities such as this gives us a chance to, again, re-envision what child welfare looks like, create opportunities for more connections between child welfare and families where there might be better or improved assessments as a result of that coordination and, a different approach, but also, again, speaks to the vulnerability of the families that we're serving and being able to engage in efforts such as this to provide essential supports. So finally, I won't go and read through these, but this was really a powerful experience for our field staff as well. And I think we actually have a few Michigan participants on our webinar today, and I just want to convey my utmost appreciation for workers who really made an adaptive shift from this more sort of compliance and punitive approach to just being helpers. And as a result, you can see some of these stories. Staff were really positively impacted. So we can talk, about the possibility of retention when you're going to work feeling like you're doing what you really set out to do. But as you can see in some of these stories, 2 families, we had a mom who said, I have lost 2 family members, and frankly, you're the first person to call me. Who figured? CPS is calling me. So re-envisioning in a way that provides more suitable connections and a more responsive child welfare system within Michigan. And then with that, I'll turn it over to Angela.
Thank you so much. And thank you, Kate, for the invitation as well. I appreciate the opportunity to speak to everyone. But first, I must acknowledge and commend the remarkable work and leadership provided by our state child welfare agencies and the various State Department of Human Services across the country. I just want to take a moment to applaud how you have adjusted your practices to serve families and children effectively under such unprecedented and challenging conditions. I recognize that you are doing so during a time of uncertainty amidst budget challenges and strain on our workforce. As one of 10 regional administrators for ACF, I had the opportunity and the responsibility to contact our state commissioners within my regions I was working with at the onset of the pandemic to hear their concerns and their needs, and then to quickly relay those issues to our Assistant Secretary Lynn Johnson, her COVID-19 policy work group, so that we could rapidly respond to what we were hearing. And during those calls, we heard so many great innovative practices that were being stood up across the nation. I remember talking to Secretary Manning from the state of Delaware early in April, and she had just created the emergency homes for children whose foster parents had fallen ill with COVID-19. And you look at California, they invested millions to support overtime work and additional outreach by county social workers to foster family caregivers who are at higher risk of COVID-19. States are leveraging technology and communication to support parents in needs. New Hampshire, as an example, provided telephonic case management and parent coaching. They also established this peer-to-peer network to connect parents to the support that they needed. And Nebraska, the Department of Health and Human Services, under the capable leadership of Danette Smith, she increased communication with their stakeholders. Each division director there held weekly calls with all of the private providers to keep them updated on changes in policy so that they were able to evaluate together what was going well and what was not. And they also made sure they were making sure their providers heard and learned what us, the federal colleagues, were saying to them. So again, thank you goes out to all of our state leaders and our essential workers who have truly risen to the occasion and carried us through and is still carrying us through this pandemic. But now, taking what we have learned from this experience, I want to put the lessons from this period in context to not just the federal response, but the direction of the agency and the administration as well. Now, there are two areas that have been a focal point for this administration, and those two areas are prevention and permanency. And you've been hearing the prevention piece, which is a critical component for us. And I'd like to take a moment just to quote Jerry Milner, who's our Associate Commissioner for Children's Bureau, and he said, "Our current crisis has illuminated the pre-existing weakness of a system designed to react rather than to proactively focus on the value and capacity of parents to care for their children. We all have an immediate opportunity to be a support to families, children, and young people who may be struggling, to show them that we care, to check in on those who may be isolated and under stress, to offer help," unquote. And I think you even heard that through Danielle and others, the critical nature of us being in more of a preventative end and helping at the front end of our service system. So our vision at the Administration for Children and Families is to move systems upstream, using a whole family approach that proactively connects families to services before they're in crisis. So the service array that is accessible to our families who may be in need of or at risk of abuse and neglect is really mission critical. When we allow the basic needs of families to go unmet and wait for someone to file a neglect report to our child abuse hotline, then we've actually failed our families, because our child welfare system only offers few alternatives to the dire circumstances that we find many of our families in, particularly in light of COVID-19. You know, so many of our families are in desperate need of critical support, and we must ensure that we have access, that they will have access to what they need to keep their children safe and at home. And it is in this area where we connect the administration's direction and the policy priority around prevention services and permanency for children. There's a new executive order on strengthening the child welfare system for America's children that the President issued on June 24th, and it exhibits the commitment of this administration to improving the child welfare system by working to prevent child abuse and neglect and assign children a forever home, a forever family. And we do this through addressing three key areas of reform. The first key area of reform in this executive order is strengthening the partnership between states and the private, public, and faith-based organizations to help support families and safely place children into permanent homes. The second, the executive order increases educational tools for caregivers and youth in foster care. Now, this serves to prepare and support foster and prospective foster parents as they navigate through our system. And then lastly, the executive order improves federal oversight, which will help ensure that children safely achieve timely permanency in loving homes, whether through reunification, through guardianship, or through adoption. So this administration will continue to use all of our resources available to us to make sure that all children benefit from a safe, stable, and loving home, which we all know every child in America deserves. Now, this current crisis also provides an opportunity to focus on how child maltreatment is preventable. Together, I believe we can collectively support families and help them build or maintain resilience to weather through these difficult challenges and prepare them to deal with stresses that can become toxic and deplete their protective capacities. One of few federally funded programs that focus on prevention of harm to children is CBCAP, our community-based child abuse prevention programs. I used to manage one of them in Indiana. But our CBCAP typically funds programs like voluntary home visiting programs, parenting programs, family resource centers, respite and crisis care, parent mutual support, and there's other family support programs that are kind of housed within the CBCAP funding stream. But the beauty of CBCAP programs is that they offer an existing infrastructure to provide effective assistance that promotes family stabilization during this time of considerable, let's say, uncertainty. So I opened with lifting up the great work states were doing across the country. And I would like to close with lifting up the great work being done by our CDCAP provider community as well. Throughout this pandemic, our community-based providers have been conducting virtual home visits, including those targeting fathers, and they have been able to maintain successful engagement of parents. Now, when video conferences is not an option, the community providers are making weekly phone call check-ins with families, and they are even, some are continue some of their in-person interactions while taking the necessary precautions. Now, these connections have helped parents and caregivers maintain critical social and emotional support while practicing physical distancing. But in closing, moving forward, we can emerge from this crisis stronger. We can emerge from it stronger together by concentrating on our efforts on transforming our existing child welfare system into a child well-being system that brings together collaborative efforts that support families, mitigate risk, and allow families to thrive. So thank you again, and I look forward to our continued discussion. And I'll now like to turn it over to Kate.
Thank you. Thank you to all of our panelists for your really thought-provoking work and reflections. Just for folks who are in listen-only mode on the webinar, we do have some time for questions, so I really encourage you to go ahead and put those in the Q&A box, and we'll get to as many as we can. I have a few for our panelists, though. I wanted to start with a question for all of you, which is, what do you think are the most urgent questions that we need to answer to really understand how the pandemic has affected families? And as a follow-up, how do we go about answering those questions? Anyone who'd like to jump in? Carrie, you might be on mute.
No, I thought Angela was going to jump in. And so I was pausing. This is tricky. So, you know, I think one of the things that is changing very quickly are the supports that families have available to them. I am particularly concerned about the collapse of particular supports that families have, in particular the child care industry, right? Federal stimulus, we gave more money to Delta than to the child care industry as a whole. And I am concerned about the kinds of supports families currently need, and as our economies open back up, what kind of supports are available for them to do that in a safe and consistent manner. And so I think the most pressing questions that we have about families are kind of around like time use. What are families, what is their daily life going to look like? Are you going to be going to work? Are you still furloughed? Are you working from home in an industry that allows it? So what does that look like? Then what does the need look like? And then what kind of supports need to be there to help you? And of course, public school is open sort of some places, some places not. I have 3 small children that are in public school, and every day I check my email waiting for that email that says, just kidding, not there anymore. And so I think we have to think very carefully about the shifting sand that is underneath families and how we are going to be able to, right, because this isn't like a surprise anymore. Like, we know that it's coming. And so to prepare for the different scenarios that families are going to find themselves in different pockets throughout the country, maybe not everywhere, maybe not universally, but we certainly know that that's going to happen in different places.
And this is Angela, and thanks, Yara. I was trying to get off mute. I just didn't do it successfully. Sorry about that. But on the federal side, one thing that I know that we have somewhat of a concern is that if the supportive services are not there for families that are already involved in the system, their children may be at the point of them exploring PPR, we have to be very cautious in what we're saying a parent did not accomplish if those services are delayed or if they are not accessible or if there's some barriers or impediments that are there because of the pandemic and because of access. So before we're following TPR, we're really encouraging states to look at what process they have in place to kind of review what programs do we put in place for them and what actually worked, what were accessible, what did they actually able to accomplish, and if there's any delays in that, was it on our behalf as opposed to the parent not following through. So we don't want to have children being removed and TPR closing without making sure that we've done every due diligence and every effort to make sure our service array is accessible, and what that parent actually needed is what we referred and they're able to access and get a hold of.
Yeah, so something I'm thinking a lot about along these lines gets to what Danielle was talking about around the service gaps that exist, sort of the difference between what families might be requesting and the services that we actually have available. And so one thing I really want to know is, maybe this is my bias, but, thinking qualitatively, from families, what is it that they feel that they could benefit from right now? So we might have all the therapeutic service referrals in the world, from mental health treatment, domestic violence counseling, but maybe what I used to hear from families before the pandemic at least was we need things like diapers, bus passes, the things that are really causing a lot of stress in our lives. And I think with the pandemic, it brings it exacerbates some of the stresses that existed previously, but there may also be new stresses related to remote schooling and social distancing that we don't have yet the resource capacity built up to address. And so in thinking about how our systems can be responsive to families, I think it's really important to hear from families themselves what they could benefit from.
Thank you. So we have a question. Danielle, I'm going to direct this to you because it's about Michigan. The question is, did Michigan assess the extent to which the service needs identified by families they contacted could be met by services eligible for Families First funding, given the requirements for eligible interventions and candidacy requirements?
Great, and I'd like to thank David for that question. It's something that we certainly have evaluated. I started typing, so it does make it a little easier to just answer it, so thank you, Kate. So we are in the process of geomapping right now to look at, with the help of Cape and Hall, what service array do we have accessible to families? Are those evidence-based programs that are approved by the clearinghouse? And frankly, still evaluating our candidacy population a bit in Michigan to understand that overlay as well. So I can't answer fully the question because we're still in the determination phase, particularly of candidacy and the populations to be served, but I can say this data and information will help guide our solutioning around that, in addition to the work that our researchers have done to support our increased understanding of what evidence-based programming is out there. I will say domestic violence is probably an area of concern because there's not a plethora of evidence-based programming that's available to states in that particular service array area. But I will certainly say that it does expand our understanding of what particular items, as David asked, that families were asking for, and how are those services available in Michigan now, and then how we can ensure that our plan for Family First aligns with what families are inquiring of through our outreach.
Thank you. So this next question, I'd really like each of the panelists to provide a response to the extent that you have one, which is, I think you've all touched a little bit on the fact that this pandemic, as hard as it is to identify silver linings, there potentially are some. There are opportunities. So I'd really like to hear you just reflect on what opportunities the pandemic has presented for lasting change in child welfare, and similarly, what innovative practices are you hearing about or you seeing that you think might be carried over into the after times?
So this is Angela. And one thing I will say, especially those who are on here listening today, the federal government and the Administration for Children and Families definitely want to hear from states of what we've allowed and have provided opportunities for you to experience and change and do during this time, of what we should maintain. So we are definitely open to hearing from states, and those are things we ask. And I ask commissioners when I meet with them, you know, what allowance has been, what waiver has occurred throughout human services that you want to see ACF maintain. So please know if there are things that you've done differently that has been because of a change in our policy due to the pandemic, let us know if those are things that actually help your state to function optimally, so that we can work on trying to make those things permanent. The Assistant Secretary is open to that, and we want to hear that. The other thing is, I think what has presented an opportunity, as we all recognize that the hotline calls in terms of educators making those calls have gone down, and it really relies on us to have more creative means of connecting with families. It should actually have increased the opportunities for some of our county office to talk to superintendents, to school districts, to partner with them a little bit differently. You know, when they're doing the schooling by virtual schooling, you know, can they check for certain things? So hopefully it has increased our ability to partner with some of our critical stakeholders in a different way. And hopefully it has also exposed the opportunity for us to really push up the preventive end more critically in the service array and into our case of work, if you will. How can we include our prevention services in a more impactful way and make sure they're at the table sooner rather than later?
So I think, so part of my research team, Meg Feely, Lindsay Bellinger, and Will Schneider, one of the things we've been really hoping to see in the before time, as Kelly says, is a focus on child well-being from other agencies, not CPS, right? CPS is indispensable. CPS is amazing. We need CPS. Like, this is in no way. But CPS can only do so much. And 75% of child maltreatment referrals are neglect-related. And so, and a lot of that has to do with poverty. And I really want to see other agencies focused on how their policies and how their programs affect kids, and to really see them strive for their programs and policies improving child well-being, right, in particular. And one of the things that I've seen is we know this can happen, right? When we shut down schools, there was an immediate conversation about child well-being. There was an immediate conversation of how do we get foods to kids that rely on food for breakfast and lunch in child care settings. How do we, you know, there's a whole bunch of services that are about to come to a halt. How do we still get those to kids? And Herculean efforts, right? Clearly there were gaps, but Herculean efforts happen. So clearly this can happen. And there's been an enormous conversation about the child care sector in Congress. Betsy Stevenson testified at the Ways and Means Committee. I don't know, time is a bit funny for me, but maybe 1 to 2 weeks ago. So like having these conversations more robustly, that this is not a job for CPS. This is a job for the country. This is a job for our government. And those are conversations that I would really look to see continue to happen.
Yeah, absolutely. Just to jump on that, I think this is a real moment where I'm hoping that there's greater advocacy and attention on the needs of caregivers, and that caregivers' needs can really be central in public policy these days, not just within CPS, but across all agencies. And as I sort of spoke to a bit in my comments earlier, I think we really have this opportunity right now to rethink our model of supporting families in a way that is not filtered through or reliant on surveillance, which, like it or not, is really central to what CPS does. And I think I would be remiss if I didn't mention that this pandemic has really been happening in tandem with greater mainstream attention to racial injustice and systems like policing. And I think that child welfare is really central to those discussions as well. So I'm looking forward to continuing to think with others about these connections because I think it is a really unique moment and opportunity for lasting change.
Danielle, do you have any thoughts to close with?
Sure, I'll just really quick close with. I would lean on something that Dr. Fong said earlier in relationship to the urgency to reevaluate our systems, the way we process, calls and referrals, the way that we assign, the way that we categorize. To really, there's an urgency around understanding if we're denying about 75% of cases. Could we strategically support or envision a different system that might entail different responses, as you said, or different levels of supports to family, or looks very different. But I do think there's an urgency to evaluate that data and our current process and systems in place.
And Katie, I know the time. We're at 2 o'clock. There's just one thing I want to say, and I heard it from the commissioner, I also saw it within our administration as well. During this time, we have really emphasized taking care of ourselves. And we started recognizing we as employers, as leaders, we've got to provide varying opportunities for people to take care of themselves during this time. And I hope that once we get through this pandemic, we don't lose sight of that, of really valuing our essential workers, valuing the work that we do, because it actually, it's hard for us to try to help others when we won't even allow us to help each other and help ourselves and take care of ourselves. So that's one thing I think was lifted up that we want to maintain.
Thank you, Angela. That's the perfect note to end on. And thank you to all of our panelists, everyone who's joined us today. You'll be able to find the recording shortly. Thank you again. Be well.